I don't think it's a surprise to anyone that we have a serious issue with mental health among adolescents. And I think there is a cultural issue at play here that is just, we're seeing it at a higher level than we've ever seen before. And you brought up a really good point about, what happened with COVID, what were the effects of it. When I can tell you, as someone who is in recovery, when I was using prescription painkillers before the what we called the pill mills got shut down in Florida, you had really kind of a run on this kind of drug. What happened was, Florida shuts down all these pain clinics and pill mills, as we called them, and immediately people don't know where to turn because there was not an alternative in place. It was shut off the supply, right? And so that's when we see the rise of the heroin epidemic in the 20 teens, So we see that rise happen. We see a rise in heroin use. And it's around that time, though, where we begin to see in the late teens, where we really start to see fentanyl come on the scene, which is really used as a buffer, or rather a way to make things more potent that are not natural. And so what we're seeing now is with kids kind of being home during COVID, the question is, like, people a lot of times don't realize they're taking fentanyl. They don't realize what it is they're actually ingesting. And what we're seeing with kids, though, today, I think there is a severe mental health epidemic at play, and it's going to come into some of the behavioral disorders. We are seeing we're seeing a rise in concerns of different types, new types of addictions, some that are defined specifically, like gambling, problem gambling and gambling disorders. But we also see others that are on the rise that are behavioral issues that are designed to, again, stimulate your mind, similar to how a drug does. It becomes a disorder, and a lot of times it comes with something else. But there's a clear mental health crisis that's going on with kids, adolescents at that age. So the question is, why? Why is this happening? If kids are being taught more than ever before about mental health issues. So there is one other thing to consider, which is kids are being talked to about this more, which means respondents are being more honest. So there is a potential that some of the things that the respondents are actually saying, that some of this could be in previous years, but that we're only seeing it now. So again, the question when you see a spike or you see a rise is this something new, or is this something that is being reported for the first time? And that's what I'm not sure of yet. But I can say with certainty, regardless of that, 13.4% having thoughts of suicide tells me that we have a serious issue plaguing our kids, and it's getting worse.
Absolutely. But you bring up a good point too, as far as the fact that these conversations are now being had more, whether with children and adolescents, whether they're with their parents or treatment professionals. Thinking back to like when you and I were kids, if somebody had come up to me and said, "Hey, are you struggling? Is there anything going on with you?" I don't know that we would have answered those questions honestly, or even known what to look for to answer those questions. So yes, I think to your point, you never want to say numbers those high are positive, because they're not. But you do have to wonder if it's also because it's being talked about more, it's being addressed more, and as a result, it can then be treated better, which obviously is the ultimate goal here. So, those numbers are staggering. They are, hopefully, people will see that and be able to do some good with that as well too.